What is National Breast Cancer Awareness Month? And we're all sitting up here. Both of us ladies have some questions for this lady to my left, Dr. Bridget O'Brien, and you're with Texas Oncology.
Yes.
So many questions here. Let's start with risk factors, because it doesn't sound like it has to be something you inherit from another woman in your family in order to get it.
Correct. About 80% of all breast cancers occur sporadically, meaning they just happen. There's no family history. So the risk factors to think about are most breast cancers are stimulated by estrogen. So what our exposure to estrogen is very important. It's not only made by the ovaries. Our fat cells are actually able to produce more estrogen. So it's really important on focusing on maintaining an ideal or normal body weight. So anything that you can do to maintain a healthy lifestyle, exercising most days of the week, and eating healthy will all help reduce your risk, but also being overweight could increase your risk. Some of the other things, vitamin D deficiency has actually been shown to increase your risk of breast cancer. So talking with your physician about your vitamin D levels and supplementation can help with that.
Wow, those are two things I didn't know.
I know, 80%, that number seems high because I know in the past people have really associated it with family history. So when is a good time for women to really start being more concerned about this? Like what age?
Going in for mammograms, that sort of thing.
Well, I think it's important to start being self-aware in your 20s. So the first step would be knowing your family history, to talk to your doctor about being at risk, because MRIs could start as early as age 25 and mammograms as early as age 30 if you're at risk for breast cancer by your family history or genetic history. And then also just being self-aware, knowing what your normal is, being able to look in the mirror and do your self-exam and know what's changing and when to talk to your doctor.
When is a time, what's a certain thing that should be a trigger to say, okay, I need to go to the doctor?
The family history, and then on exam, just if you're feeling a lump that hasn't been there before. Our breasts are change all the time, and you can feel lumpy, bumpy changes. But if you feel something that's new for you, then that's important to talk to your doctor. Also, skin color changes. If you notice any dimpling of the breast, or if you see that the nipple's being pulled in or change in direction, that's important. Also, scabbing of the nipple that does not heal is important to talk to your doctor about.
Thank you so much for coming in. And you know, breast cancer, we hear about survivors a lot, and this can be conquered. I mean, how well are people being able to conquer breast cancer? Very well. If we catch it early, then we are able to do that fairly easily. The survivorship for breast cancer is very high. So that's our goal in trying to get women to come in and talk to their doctors about their family history, about their exam concerns, and then getting those mammograms starting at age 40 and doing that every year.
And the research seems like it's just phenomenal now. Like it's cutting edge stuff, so it could get better.
It is so exciting. It's changing all the time, and we're able to do less and have the same or better outcomes. Well, thank you so much. That's a good positive note to end on. Yes. I appreciate it. Thank you for having me.